Good morning to one and all. I am Dr. Vidhi Gupta, an assistant professor in Mahatma Gandhi Physiotherapy College, MGUMST Jaipur. Today's topic that we're going to study is posture. Now, posture, we'll be studying the biomechanical aspect of posture as well as the deviations that are there, among which the patients suffer with. So let's move on to understand what posture is. So posture is a position or an attitude of a body, a relative arrangement of body's part for a specific activity or a characteristic manner of bearing the body. In simple words, posture is the arrangement of the joint in a right angle in the right way. So there are two types of posture. One is inactive posture and one is active posture. Active posture majorly comprise into static posture as well as dynamic. Static, like we are sitting in a straight way, we are not moving, that is your static posture. And dynamic means when you're walking or you're running. That we'll study forward in the gait analysis part. So let's understand the basic concepts of posture. So we human have a very characteristic component, a very unique characteristic, that is we can stand erect. No other mammal can stand erect, but we as human beings can stand erect. Now this also gives us some certain disadvantages in comparison with the quadrupedal stance. Like erect bipedal stance increases load on the heart, vertebral column, pelvis and the lower extremity. Also it reduces our stability. Now, there are a few terms that we need to understand when we are talking about posture. One among which is center of mass, base of support, and line of gravity. So, what is a center of mass? Center of mass is something that lies in the center where the whole gravity is acting. It happens in every object, like it is a rod, it is a human body or a table or a chair. They will all have a center of mass where the gravity exactly acts. So in human beings, this center of mass lies at the second sacral vertebra. Now coming on to the base of support, it is the support that we get. When we are lying, our whole body becomes a base of support. When we are standing, the area between the 2 feet become our base of support. Then third thing is the line of gravity. The line of gravity is an imaginary line that passes through your center of mass so that you can maintain an erect standing position where there is minimal muscular activity, minimal internal activity that is being used against the external gravitational force. Now, all these 3 things have to be in same proportion, in same line, so that the patient does not adopt or the individual does not adopt a faulty posture. Now, what optimum posture is? So, when we talk about an ideal standing posture, it is the arrangement of the body segment which is vertically aligned to the line of gravity. But our normal individual body does not allow us to be in that ideal in a straight line. We have some curves which deviates us from the ideal posture. That is called the optimum posture, where the line of gravity is closest to the ideal standing posture, but it does not go through the joint axis, but closest to the the ideal posture. In this situation, there is some forces that act on our body. One is external force, and to counterbalance that external force, we have internal movements, right? Which is our anti-gravity muscles that are acting, some ligaments, some joint capsules. They work to maintain this erect bipedal stance that we are in. Slight deviations from these optimal posture is expected from the normal population. Okay, slight deviations are okay. And we expect that every individual is different and some of the deviations will be there. But a large deviation in that standing posture can cause an excessive strains on the passive structures, the internal movements that are being the passive capsules, ligamentous tension, muscular tension. It can have an excessive strain over these passive structure, which could yield a high level of muscular activity, and these could cause further postural deviations, which could impact our living situations. So if faulty postures are habitual and assumed continually on a daily basis, the body will not recognize these faulty postures as abnormal, and over time, structural adaptations such as ligamentous and muscular shortening or lengthening will occur. Now we'll first do the analysis of the standing posture. So analysis of the standing posture we are doing in the sagittal plane, and we usually use the plumb line to analyze our posture. So what is a plumb line? There is a big thread that is attached to the ceiling, and there is a weight, all right, at the end of the thread. That thread will be very straight, right? It acts like a line of gravity passing through your that imaginary line of gravity. It is passing through your body, and we'll see how it is passing and at what levels it is passing. So as you can see in this picture, there is this line of gravity that is passing through your body, and it is passing through the center of mass, right, at the second sacral vertebra. Now it passes at every point. It will pass at ear, your cervical, thoracic, lumbar, then of course your hip joint, knee joint and ankle joint. Now we'll see at what different levels it is passing, whether it is passing anteriorly to a joint or posteriorly to a joint or through the joint. And through this only we decide if the patient is in an optimum posture or has it deviated from its optimum posture. So let's talk about the ankle joint. So when we are talking about an optimal erect posture, then ankle joint, the line of gravity, as you can see in the picture, it passes, this is your ankle joint, right? But it passes anteriorly to your lateral malleolus, right? So because of which there will be an external dorsiflexion movement which will be opposed by our internal plantar flexion movement. That's why our plantar flexors are anti-gravity muscles, right? Next, we'll move to the knee joint. So when we are talking about the knee joint, in the knee joint, we have two things, right? Firstly, the line of gravity, it passes slightly anterior. It passes slightly anterior to the midline of the knee, but posterior to the patella. As you can see, the line is passing posterior to the patella, right? It is anterior to the knee joint, but posterior to the patella. So the actual external movement that is happening is extension, and it is being counterbalanced with your flexors, all right? So that we do not go into hyperextension. Next, we'll move to hip and pelvis. So as you can see in the hip and pelvis, the line of gravity, it passes slightly posterior to the axis of the hip joint. It passes slightly posterior to the axis of the hip joint through the greater trochanter, because of which there is an external extension movement which is being maintained by the internal flexion movement done by your muscle iliopsoas. This helps in preventing hyperextension of the knee. Next, we'll move to the lumbosacral and the sacroiliac joints. So in the lumbosacral region, in the optimal posture, the line of gravity passes through the body of the fifth lumbar vertebra. It passes through the body of the fifth lumbar vertebra and close to the axis of the rotation of the lumbosacral joint. Now the gravity will act, and gravity will cause slight extension movement at L5 and S1 that tends to slide the L5 and entire lumbar spine down and forward on the S1. This motion is opposed. किससे opposed होता है? This motion is opposed by the anterior longitudinal ligament and the iliolumbar ligament to maintain the stability. Next is your trunk. When in an optimum posture, the plumb line of gravity goes through the midline. It goes through the midline, as you can see in the picture. It goes to the midline of the trunk. Then is your head. Now coming on to the head, the line of gravity, as you can see here, this line of gravity is passing slightly anterior to the transverse axis of the rotation for flexion and extension of the head. So the external movement is flexion, which has been counterbalanced by the internal movements that has been generated by the ligamentum nuchae, tectorial membrane, posterior aspect of the zygophyseal joint capsules, and the activity of the capital extensor. So there is an external flexion movement which has been counterbalanced by the extensors. So this entire was how the line of gravity is going in an optimum posture at different joint axes. Now we'll understand the deviations from the optimal posture. Now what is deviation? Deviation means that now this line of gravity is not going anterior to the ankle joint, for example. It is going posterior to the ankle joint. Now this will create an external strain over the muscles that we are using, which will impact the position, the stability, the equilibrium of the individual. So this deviation from the optimal posture Actually, the optimum posture is minimum energy expenditure while we are standing or sitting or maintaining any posture. But when we are not in that minimal energy expenditure, we are using maximum energy expenditure, that creates a problem. So let's see from side alignment what all deviations we can see. So in the foot and toe, there is one condition called claw toes. Now this claw toe is where there is hyperextended the MTPs, flexed PIP and flexed DIP, because of which the base of support is reduced. And because of the reduce in the base of support, there is postural sway and will decrease the stability in the standing posture. Next condition that you can see is hammer toe. Now in hammer toe, there is flexion of the PIPs, which will again cause what? Decreased base of support and decreased stabilities. In knee joint, as we studied in the optimum posture, knee joint, the line of gravity passes anteriorly to the knee joint and posterior to the patella. But in a flexed FFD, any fixed flex deformity, what will happen? The line of gravity will pass posteriorly to the knee joint, thus creating overstrain on the muscles. Next is again hyperextension. As the knee was flexed, then also there is an issue. If the knee is hyperly extended, genu recurvatum, then also there is an issue. So again, if the knee is going into hyperextension here, the line of gravity will pass anteriorly, quite much anteriorly to the knee joint, which will create an impact over the musculars. Coming on to the pelvis, as we have seen in the pelvis and the hip joint, that the line of gravity, normal line of gravity, passes slightly posterior to the hip joint. But in this situation, when there is an excessive anterior tilt, see this anterior tilt, now the line of gravity will pass anteriorly, right? So because of which the pelvic angle is changed and there is an increase in the lumbar lordotic curvature. So there is an increase in the lumbar lordotic curvature. This could also impact the individual's posture and the muscular strain. Now coming on to the vertebral column, there can be two deviations in the vertebral column. One is lordosis, that is increase in this concavity, and one is kyphosis, that is the increase in the convexity. So these two structures can also create an impact. If increased convexity, the person would be with a forward posture, like forward shoulders and a bit stooped nature. And increased concavity will increase a big space over your lumbar regions and the neck regions. Coming on to the last thing, that is head. When we see our head, one condition that is forward head posture, which is quite prominently seen in the corporate sector workers who are working continuously on the laptops. Now what happens is, because of this posture, the head is coming forward, right? The head should be slide back, but it is coming forward, thus increasing the lordotic curvature of the cervical spine and also creating a large impact over the muscular structures there present in the neck. So these are the various postural deviations that we see, and through this we'll understand that how deviation can impact many different muscular structures, and as physiotherapists where we need to work on these muscular structures to improve the posture of the patient. Thank you.